Good morning everyone and welcome to today's Strategy and Resources Policy Committee. It's the extraordinary meeting on the 19th of December. Can I thank everybody for attending today's meeting. My name is Councillor Terry Fox and I am the Chair of the S&R Committee. I'm also leader of the Council. The meeting today is open to the public. However, the appendix on item 7 on the agenda is not available to the public or press because it contains exempt information. If members wish to discuss the information in the appendix, please highlight to me when we get to that item. We have received no questions or petitions from the members of the public by the deadline. Please can I request the mobile telephones and other switch equipment are switched to silent mode so as not to disturb the conduct of the meeting. There is no fire test planned for today as it went at 9:30 this morning for those that was in. If there is an emergency evacuation, please take instruction from the Town Hall staff and the assembly point is Tudor Square. Can I now ask each member of the Policy Committee to introduce themselves? Richard.
Thank you, Chair. Richard Williams, a member for Stannington Ward.
Thank you, Martin.
Morning, Martin Smith, Councillor for Dorn-Tobby.
Shafak Mohammed, Ecclesall.
Councillor Jordan, Dorn-Tobby. Thanks.
Paul.
Good morning, my name is Councillor Paul Wood and I represent the Woodhouse Ward.
Thank you, Paul. Julie.
Good morning. Apologies, Chair. Good morning, Councillor Julie Grocutt, Stocksbridge and Upper Don Ward.
Thanks, Julie. Brian.
Councillor Bryan Lodge for Burley Ward. I think she was just playing for time there, Chair, to help our colleagues here log on.
Thank you. Douglas.
Thanks, that's what we need, a bit of cooperation. Yeah, Douglas Johnson, City Ward.
Thank you, Douglas.
Angela Argenzio, Broomhill and Shallow Ward.
Okay, thank you. Can I just get officers? Kate.
Kate Josephs, Chief Executive.
David.
David Hollis, Interim Director, Legal and Governance.
And Craig.
Craig Rogerson, Democratic Services.
Thank you. And I'll ask officers to introduce themselves as they introduce the report. Thank you. So, moving on to that item 2, have you any apologies for absence?
Chair, I've received apologies from Councillor Mick Rooney.
Thank you, and we send our best wishes to Mick over this festive period to get well. And I'm sure I'll get a number of emails from him shortly questioning what decisions, but best to him and his family. And also I must add to Councillor Jackie Sater, who's also in hospital as well. So I will send our best wishes to her and Ray. The next item is item 4, any declarations of interest? Douglas?
I'd probably have to do a personal item or personal declaration on the item about GP surgeries, which is 6, just because I'm a patient at one of the surgeries that's listed there.
Right, and so one of my surgeries is involved in that as well, so thanks for that, Douglas. Item 5, public questions and petitions, we have got none received in the time. So straight on to then item 6, primary care capital programme, the GP hubs. Is that Joe?
My name is Jo Horrobin. I am the Director of Integrated Commissioning. And the report that I'm bringing today is to request that the committee endorse and agree to the capital project that we have been working alongside our colleagues in the NHS with in order to develop new healthcare facilities in the city. The Treasury awarded £57.5 million to South Yorkshire as a whole in March 2022, and solely for the improvement of primary care buildings in the region. And of that, 37 million was allocated to Sheffield. subject to the submission of a robust business case. And the City Council was approached at that point by South Yorkshire Integrated Care Board. It was the clinical commissioning group at the time, to work in partnership in order to secure the capital projects. The Council has been able to support the capital project by identifying suitable sites through property services and commissioning feasibility and design work paid for through the capital fund from the NHS. And we've done that so far on behalf of the South Yorkshire Integrated Care Board. The Integrated Care Board has also asked the Council to act as a delivery partner, and that is because the ICB itself, because of restrictions from the Treasury, is not able to own or develop their own assets. And therefore, this was the best mechanism, really, to secure that 37 million in the city for development of primary care. The capital development programme itself is to build up to 5 new health centres in Sheffield. In fact, it's very likely that it will be less than that. However, for the purposes of this paper and for the approvals, we are requesting that it is up to 5, and those are in Foundry Primary Care Network, the SAPA Primary Care Network, and a development in the city centre. And these developments, it's important to say, will mean the replacement of a maximum, depending on the number of new centres, of 12 existing GP practice buildings as part of up to 9 practices. There are some challenges in terms of finding a location for the centre in the city, and that was therefore not been consulted on recently. We have been through, I say we, it's actually our NHS colleagues at the Integrated Care Board have undertaken considerable pre-engagement and then full consultation with people across the areas affected by the potential development of the new centres. The city is in urgent need of improved healthcare facilities, particularly in the north of Sheffield. And the current state of the stock of the estate in primary care is a real challenge to the recruitment and retention of GPs in the north of the city. The reason for that is because GPs are usually responsible for the buildings that they own. And many of them are stuck currently with really liabilities rather than assets in buildings that are no longer fit for purpose for modern healthcare. The new healthcare centres will provide a more spacious environment. It will improve access, disability access in particular. There will be room for training staff, and there will be the potential to include other diagnostic activity within those centres, meaning fewer trips to the large hospitals, the Northern General and the Hallamshire, because it will be easier to get straightforward diagnostics done at the health centres. It's also expected, therefore, that the new buildings will improve outcomes and the experience for patients. As I've said, a number of GP premises are really quite outdated now and too small to deliver medicine in the 21st century. We consider that this best way to improve the stock is to proceed with the proposals that will secure 37 million or close to that for the city of Sheffield. There is competition for this money. Other areas in the region are very keen to secure any spare money that we are not able to spend, and hence the urgency of bringing this to the committee today. So the proposal, I'm very happy to take questions. It has been a long year for our Integrated Care Board colleagues developing this proposal at breakneck speed as a result of the constraints and the timescales on this from the Treasury. And so I'd like to recommend that we note that work that has been undertaken already, and we approve the proposal that we, as a council, become the delivery partner for those healthcare facilities, and that we enter into an agreement with South Yorkshire Integrated Care Board to be their delivery partner and to be the accountable body for the funding. There are also a number of delegations which I won't read out line by line. And just to note that individual development proposals will progress via the Council's established capital approval process. So we'll come back through that process one by one as they are ready for sign-off. Happy to take any questions.
Thanks, Joe. I've got Shafak, Angela, Martin, then Douglas.
Can I just, it's 4.5.1, page 10, or, yeah, 10. It's the property implications section, yeah? You know, in the SAPA 1, basic Concord Sports Centre, you've got Melrose Surgery. Isn't that in Burngreave? That's a long way away. Is that?
Yes, and I'm happy.
Yeah, I'm just questioning why shouldn't that be linked to the Burngreave surgery? Don't know. Sorry, go on.
Apologies. Yes, the locations that are set out in here are for the proposed potential locations, and I should be really clear that actually at the now, as opposed to when this report was written, this is a fairly rapidly evolving process, and based on feedback from people in that area, the Concord Sports Centre proposal won't be going ahead. So I can check that detail, but it is possibly a moot point insofar as that proposal won't be going ahead.
The reason I question it, Chair, is because if you look at where Shire Green Medical Centre is, it's around the corner. And the Firth Park Surgery is down at the bottom. But then you've got, I just looked at that and I thought, well, if I lived up near Melrose Road and this surgery, yes, I'll be absolutely against this. Now, the question is that an error on someone's part? Because actually, if their surgery is closing, then Burngreave, Spittle Street might be the place. Because personally, this is investment into Sheffield, and let's be honest, these are the areas. I mean, there's that famous study, isn't there, from the bus journey from the ward I represent that goes through many parts of this, and ultimately life expectancy goes down. Now, I don't think anyone in this room is against investment in improving health centres, because one of the issues is that a lot of the older GPs surgeries are in basically residential homes, houses that were there in the 1940s, 50s and 60s. And what we're looking at here are potentially modern buildings like we've got in Darnell, on Main Road, Prince of Wales Road, where it's almost a hub, a wraparound service. And, you know, having a GP surgery or complex next to a sports centre, for me, makes quite interesting prescriptions. You know, usually you get a prescription and you go to the chemist. Well, here you potentially be going around the corner to the doctor. So I just want to question that, Chair, if I'm being honest, whether the objections to this has been because of Melrose.
Thank you. I'm happy to take that back and check. There is a very substantial amount of documentation that sits behind this, and which has gone through the Health Scrutiny Committee on at least 2 occasions in the last several months. So I'm very happy to undertake to go away and double check that information. This is the information that is taken from those consultation documents, but I'll go away and check that for you.
Thank you, Chair. Well, will our decision today have any bearings? Because you're saying it's a rapidly moving. We want this money to stay in Sheffield. I'd like to see all 5 develop. And I hate to see a campaign led by whoever to save their little surgery, deny a really needy part of the city, some modern health facilities. So I'll definitely support all 5 developments, Chair, if possible.
Thanks, Carl. I know the LACs have been involved in this as well, so they've got that local intelligence. Angela?
Thank you for this. Thanks, Joe. My question is, I know that we don't have plans yet of what they're going to look like, but can we, because the council will be responsible for these buildings for 60 years, can we ensure that whatever we put in place, whether we are using an existing building that will be adapted, can we look what is it going to mean for 60 years so that we have something as close as possible as net zero in terms of the way we build the actual buildings to be as environmentally sound as possible in terms of energy and costs with the energy prices going up, so that we can actually have buildings that we can be proud of being the landlords of. So we'll see how it pans out, but it's great that we get this investment in the city. It's really needed, particularly in those areas.
Thank you, Angela. I've got Martin and Douglas and Julie. Martin.
Thank you, Chair. Thanks for your presentation, Joe. Any investment in the GP service in Sheffield is welcomed. I just wanted to ask about the level of risk that the council might be taking on. So we've had 1 or 2 projects recently go over budget or been delayed. Don't want to go into the details of those, but in section 4 it talks about all of the cash being repaid by the NHS. So I just wanted to clarify, if one or more of these surgeries, the projects, ran significantly over time or ran significantly over budget, who picks up the financial implications of that, please?
Do you want me to come back on that one now? So, yes, absolutely. I understand your concern, but and we are in the negotiations on the remaining terms. However, which includes any provisions that might apply in the event that the council is unable to meet the delivery deadlines of the funder. We understand that those requirements are expected to be that the grant agreement must be entered into and the money transferred by the end of March 24, with the project completion to be achieved by March 25. We are confident that that will be deliverable and doable, and but that the risk needs to be underwritten by our ICB partners, our integrated care board partners.
Thank you. So we haven't got that level of detail finalised yet, is how I understood that. Is that correct?
Yes, that's correct. That we are in that process of negotiating it. However, the basis of this report is that we would only accept to be the delivery partner should, in the event that we are able to ensure we're not financially disadvantaged at any point.
Thank you. Thank you, Chair.
Thanks, Martin. Douglas?
Thanks, Chair. Just got, I think, 3 questions. So, first of all, following on from Angela's point about the net zero, actually, can you just tell us, on these sites, is it proposed to demolish the existing building and rebuild, or are we talking about reusing buildings? I'm just thinking about things like the surgery that's currently at Spittal Street. Are we talking about a building adjacent to that, or are we retaining the building? And then linked with that, can we at least say that we aim to have net zero buildings in operation if we are doing effectively new building, and it's going to be for the next 60 years, we should at least aim for that. So that's the second question. Third question is, just in terms of the city centre location, appreciate it's not decided where it's going to be now. If there's a degree of fluidity over that, is there any thought of looking at somewhere around the sort of Kelham Island or Shalesmoor area? And ask that just because it's an area where there's a lot of people living down there now. There's been a lot of call for GP surgeries down there because actually there isn't any facility that's particularly easily accessible there. And of course, around the St Vincent's and East End, it's due to be a growth area for housing. So in the next few years could be looking at a lot of people living in that area needing healthcare facilities. And the fourth of my three questions was about where there is going to be a change of, well, I know you said that Melrose surgery, for instance, is off the table, and I know that because that's the surgery I'm at, but if it were moving there, is there going to be some kind of system to systematically enable patients who are registered at one surgery to decide how they're going to get themselves to a new surgery at a different location, or alternative to transfer surgeries to one that is now nearer? And I wouldn't be expecting the council to be leading on that, but I want to see if there's some commitment from the health services, so from the ICB. So yeah, those four, thanks.
Okay, I'll take those one by one. In terms of rebuild or retrofit, I would need to refer to the detail of each of the schemes, and to some degree there is still some fluidity in that. I'm very happy to provide you with more detail on that. What I can say, and going back to Angela's point as well, is that in terms of the environmental impact, this is an area that our colleagues at the ICB are staying very strong on, despite the fact that this increases the costs. And actually they have remained steadfast under some pressure, I think, to ensuring that we are not cutting any corners in terms of climate impact. So I can give you the assurance that you know, we are holding out, and that the ICB have the same commitment as ourselves to that, to ensuring that we have we minimise the impact, not just immediately but over the longest term possible. In terms of the city centre development and whether that could be elsewhere, I'm sorry to keep saying I will have to check, but there are some of the details of this which will be dependent on the grant criteria and on the degree of flexibility that the ICB are able to negotiate with the South Yorkshire Integrated Care Board within that context. So I will take that suggestion away. We are still keen to develop something in the city centre. The ICB are very keen to do that, the Integrated Care Board. So I will take that suggestion away, and we will see how far the criteria allow flexibility. One of the challenges for this, for the Integrated Care Board, has been the constraints really of the funding of the capital funding. And then with regards to the process of transferring or arranging travel or access for those that want to remain with their practice, this has been discussed to a significant degree at health scrutiny, and I think that's absolutely appropriate. Ultimately, each surgery will want and need to look at how they support their patients to make the transfer or to move to another practice. It is in the interests of each practice to do that. It is not something that the Integrated Care Board can decree absolutely to GPs. However, it clearly is, it will be in the interests of GPs, and we have had a lot of discussion about the importance of supporting that transfer and considering transport options and alternatives for supporting people to access who need to.
Thanks, that's really. Can I just come back on a couple of those? On that latter point, though, I'm just wondering if we need something a bit more robust about, because it's okay if people want to stay with their surgery, even though they might have to travel further, but they might equally have a valid choice of wanting to change surgeries to go to someone that's now nearer. And certainly looking at the bone grief ones here, you might want to do that. So with the way that GPs are funded, it's really not in their interest to encourage their patients to transfer to a more convenient surgery, which is just what I was wanting to see if there's some more independent process that can be done through the ICB or something. I guess I just have to leave you to sort of take it away and have a think about that, because if we leave it just in the hands of the GPs, there's like an incentive there to not give people the best advice, and it's it's not surprising that. And then just final point on the net zero stuff, of course, is, I mean, although you're right in saying that it might cost a little bit more to build, but you're looking at relatively marginal costs, but, the cost of not having a net zero in terms of running costs for the next 60 years is going to be huge. So it's the kind of thing, we don't want to be installing lots of new gas boilers now because, with the price of gas, that's going to be a lot of burden on them in the long run. That's all really, thanks.
Thanks, Douglas. Julie?
Thank you, Chair. Thanks for the report, Joe. I think we need to view this as an opportunity. It's an opportunity to absolutely finally get things right. I think we've all learned over recent years the importance of health and well-being, and I think that picks up on the point that Councillor Mohammed made about, GP surgeries being next to leisure centres, because I think, we need to get away from people turning up at GP surgeries and just being prescribed medication. There are all sorts of, other activities, health and wellbeing, social prescribing that can work really well. We have an important role to play in that as the council in terms of, are people being depressed because of the neighbourhoods that they live in, the condition of the homes that they live in. So I suppose for me it's about understanding how we are making sure that, the vision that we certainly want to see as a group in terms of our 15-minute neighbourhoods includes the health provision that is there for communities across the city, so that everyone can, is no more than 15 minutes away from their local health centre, that they have got all of the wraparound services that they need there that will, make their quality of life and their well-being so much better, because if we get that right, then, we're on the way to making sure that people live happy, healthy, fulfilled lives. And so I think it's really important that as we have this funding, although, if you like, we are the keepers of the purse, that we are making sure that that actually plays into our vision for the city as a city council. So for me, as we move forward, my request would be that we make sure that we link that into the appropriate departments in housing, in communities, in leisure, so that we have got this working absolutely right for the people of this city, so that we can do the best we can for them. I'm not sure, I've not read in any detail the feedback from the scrutiny committee, and again picking up on the point that Martin made in relation to risks, hopefully that's something that they've looked at carefully. And so for me it's about, one, understanding what the risks are to us as a council, financial and otherwise, and two, understanding as we move forward how we are making sure that we are linking this into the services that we provide as a council, because this is the opportunity that we now have to do that. So I'd like to make sure that the work moving forward includes all of that as well, please. Thank you, Chair.
Thank you. Jo.
Yeah, I think that's a really good point. Thank you. And we fully expect that the new healthcare centres will provide sufficient space for some pop-up voluntary and community sector and other services. So, for example, showcasing social prescribing, citizens' advice, as just I'm sort of giving some examples. And that's something that we know GPs feel really strongly about, is that they already have, sometimes a desk in their already quite cramped waiting room with somebody, representing various sort of opportunities in the local community. And absolutely, we will be looking to make the most we can of this in terms of how we integrate better our services and the services that exist in communities, for themselves, of themselves. And I think we have an increasingly good opportunity through the Integrated Care Partnership and through the development of our commissioning arrangements with and alongside health and the voluntary sector to exert that influence in the system, in the health and wellbeing system, through both this project, but also more widely in terms of setting strategy for the city in a way that is integrated and reflects our communities rather than our organisational boundaries.
Thank you, Jo. Richard?
Thank you, Chair. Given the level of bus cuts we've just experienced across the city, Has any work been done or carried out to reassess the reachability, if that's a word, of these proposed venues?
So the answer to that is yes. Yes, a huge amount of work has been done by the ICB, by the Integrated Care Board, to track travel distance, to track as the crow flies, but also to look at the fact that none of us are crows, and the need for understanding the bus routes. It's a real challenge even during the course of the consultation. Bus routes have changed, and that will no doubt continue to be the case. I think really the work that each GP surgery will need to do is to ensure that where necessary there are alternative means of their most vulnerable patients being able to access their provision. And actually a number of GP surgeries in the city already have identified that as a need and are already running minibuses or arranging for travel for some of their more vulnerable or frail patients. So the buses are a real challenge for GPs, as they are for many other services, and I can assure you that the ICB will continue to add their voice to the discussions in the region around the bus routes and how well they work for the citizens of Sheffield.
Thanks for that, Richard. If there's no more, just for myself, I'd just like to put a comment out there. So, in supporting this, I do have real concerns. I cannot hide away from that. I think the investment in buildings is really welcome. Certainly in my surgery, we have a very diverse community that use that, and the building is not fit for purpose. We must have 5 or 6 different interpreters at a time in there as well, with private, so it's not just a doctor's GP surgeries. But I have to say, just like many members have said, that the issue of travel from a number of surgeries that will close, that we feel are on our doorstep, to then have to travel around the city, it does cause me some concern. And as Councillor Johnson said about being able to move to probably a closer hub rather than a surgery now, and that. But following Councillor Shafai's point about this is a part of the city that has a real issue with severity of different illnesses across the board, not only mental but also skeletal, due to the work and the 83 bus, that reduction in 15 years of life across the city. So the investment in that is really welcome, and I really kind of back that. But my concern is that we get the services in those 5 areas that we really need, and I'm sure that the adult social care board will monitor this on a going through. So in supporting the recommendations, I'd just like to put on record my concerns, just like many of the members around here, but meeting the needs. But on the back of that, we have got a reduction in GPs around the city. The workload of those GPs, and many meetings, Joe, been with yourself, where they've expressed the real workload and people leaving the profession is a real major concern. So it is a welcome move in that, and a real stamp of investment in that area. So on those recommendations in front, can we agree those recommendations? Agreed? Thank you. Thank you, Joe. Thanks for that, and look forward to the report. Can I now move to item 7, just as the cathedral bells are playing outside, to welcome Liz and to Tony. Tony, would you like to introduce yourself when you get up to members, to those members that don't know you? So.
Thank you, Chair. Tony Kirkham, Interim Director of Finance and Commercial Services. Happy to be here.
Liz Goff, Head of Finance Business Partnering.
Thank you. Welcome again, Liz, and welcome, Tony, and thanks for taking up the interim role at the council. Much appreciated. Can we move to item 7 then and present the budget?
Thank you, Chair. The report in front of you today is the latest update on the progress which you've undertaken in relation to the 23-24 budget. I'm pleased to say significant progress has been made over the period, and the report before you shows that there is a small projected gap in relation to the General Fund and similarly in relation to the HRA. This is prior to the provisional local government settlement, which, as it would happen, we're now anticipating at some point today. Been checking my email, it hasn't been announced as yet, but you will know from provisional settlements there will be some details in there which will still be outstanding until the new year, particularly in relation to some of the specific grants. But we did get some guidance from the Department of Levelling Up and Housing and Communities last week, which was consistent with the principles which we'd anticipated from the Chancellor's statement, and therefore one of the significant improvements in the position is in relation to the business rates we can anticipate receiving next year. So taking into account the various different programmes of work taken by the individual committees, say significant progress has been made. Further savings are detailed as appropriate, and we are confident that in the new year, with the provisional settlement, that we will be in a position to bring a balanced budget to yourselves on the 24th of January for you to consider to hopefully put through to Council on the 1st of March, and similarly in relation to the HRA, although because of rent setting, that will be the 1st of February. Council. So that's introduction, Chair. Happy for Liz to answer most of the questions.
Thanks, Tony. First of all, can I ask colleagues if they wish to ask any questions on the Appendix 7, because we'd have to stop and then start. If they're not, we'll carry straight through. Are there any questions or comments on this? If not, we have been through this line by line on many occasions, so it's good to get it at this point, and it's coming back on the 24th, which is our next meeting. So if we can, are we comfortable to accept those recommendations and bring back to on the 24th? Agreed? Thank you very much. And Tony, Liz, can you thank the staff on our behalf? To working with all of us must be a real challenge anyway, but to get us to this stage, thank you very much. Thank you.
Thank you.
Thanks, colleagues. On that item then, that is the end of today's meeting. Be remiss of me not to wish you a Merry Christmas and a Happy New Year, and enjoy the festivities, and really do take a chance to get a break with family. That really is most important. Our next meeting is on Tuesday the 24th of January at 2 o'clock, where we'll be taking, as you've just heard, the full budget process. So thank you very much. Thanks for today's meeting. Thank you.